So thank you very much for inviting me, and I will try to present which is the situation in Catalonia around the citizen access to personal health data. It's not quite different from Denmark, but I think it's important to see some little difference. So, as you know, Catalonia, we have a health system model for 7.5 million people, and everybody is covered by the public insurance, but 25% of the population has and pays private insurance. All the centers that works in this private sector are aggregate, but an association that is named ACES. So it's the private centers, the private providers, all of them are associated to this body, to this institution. So from the public insurance, what we have is what we name My Health, La Meva Salut, and that allows to access and to consult all the information that you have from the public sector. This information is not consolidated. It's not a unique electronic health record because it's not included in this My Health from the public sector. It's not included the information coming from the private providers, the private insurance. In this case, it depends on the provider. You can have a solution or not for access to your information. So it's very variable. What we have seen, and Deepak comments perfectly, what the European regulation says is that the individual has the control over information linked to them. So it's a new and a specific new right related with the portability, in addition to the traditional ARCO rights, access, rectification, cancellation, and opposition. So today, using My Health in Catalonia, you can consult your medical reports in a non-structured way with not standards, and you can do the majority of the functionalities that you have seen also in the Denmark solution. So the e-booking, the e-consultation, and with the passport of the COVID, we have seen also a grid full. Everybody has access to their to this portal to My Health. Okay, but at the end, we cannot say that the individuals, the Catalans, we don't have full control over our data, and we don't have either portability of this data. We can only consult, we can only see this data, but we cannot share this data and use this data in a free way, interoperating with other providers. So using the Blue Button initiative that we have seen in the United States related with the Veterans Hospital Association, we think that we could develop this functionality also in Europe. So in Catalonia, we made this initiative, and we think it's the first region, the first country that using the personal health portal from the public sector, and also we hope in the future from the private providers, we are included these two functionalities, these two new functionalities. The first one is the capability to download structured medical data and reports using HL7, CCDA standards and specifications, the Blue Button 2.0, and also the guides from the EHA. And also, we develop this functionality that allows the citizen to generate and download the European patient summary that is in line with the international patient summary regulations. So we think that with these two functionality, with these two inspiration from the blue button, we can achieve a full compliance with this article, Article 3 or with the EU regulation. Here you can see the file, the content of the file of my European patient summary from my health of CatSalut, of Health Department of Catalonia. So all the data is structured, all the data is codified using the international standards. And here you can see an example of this patient summary with all the information that includes this summary. So you have a summary of the medication with all the drugs with codes. Also, you have the allergies, also the immunizations, the active problems, the past problems, the past illness, and a functional status also is possible to do with the blood group. So we think that this kind of solutions, like the European patient summary, as the European Health Data Space Common has included, we think that it's a very important and useful tool to really control our personal health data. And with this kind of tools, we think that we can share in a free way as a citizens this information or information with other users, with other interested bodies. Okay, we have promoted this initiative, Blue Button initiative. We have promoted this in Catalonia from Saluscop. Saluscop is a citizen cooperative. It's a new non-profit institution as a cooperative that use legal instruments. We are building license and technological tools where we are using anonymization and decentralization of the data in a way that the citizens can manage their personal data and create collective value. So they can share their personal health data with the researchers or with other providers in a free way. So thank you very much. This is our situation. This is our experience in Catalonia, and I am open to comment around this. Thank you.